Réseau rwandais des personnes vivant avec le VIH/Sida, RRP+, is a Rwanda network of people infected and affected by HIV.
RRP+, a network of Rwandan people living with HIV, is a non-governmental organization that was funded by HIV-positive people in 2003. We started with 175 corporations. We are now 900 and plus organizations and cooperatives.
Its overall goal is to contribute to improve the quality of life of people infected and affected by HIV. Since its creation, RRP+ has registered tremendous achievements that are categorized in 4 domains of RRP+ interventions. Primarily, RRP+ invests in advocacy, considering human rights at the center of development for people living with HIV. A special effort is made to promote women's rights and fight gender inequality, since these are the root causes of making women especially vulnerable to HIV. On the second layer, RRP+ focuses on HIV prevention by contributing to improved and equal accessibility to primary and secondary prevention measures by all. In order to reduce new HIV infections, peer educators have been equipped to support anti-HIV campaigns across the country. RRP+ is engaged in encouraging positive living among people infected and affected with HIV/AIDS in the community. The approach of peer educators demonstrates the best practice and commitment of people living with HIV in the community mobilization, especially for health services related to the prevention of mother-to-child transmission of HIV. RRP+ achieved to train 5,000 peer educators. These people are supporting increasing the awareness in the communities about the HIV, volunteer counseling and testing, family planning and adherence in the antiretroviral treatment, found loss to follow-up, and prevention in discordant couples. Among other achievements, RRP+ has proven to support care and treatment for people living with HIV. RRP+ collaborates with health facilities to ensure that qualitative care and treatment are accessible, acceptable, and affordable for people living with HIV. Economic and social impact mitigation is another measure of RRP+ achievements. They contributed to improve the economic well-being of people living with HIV by strengthening member organizations to work in cooperatives and develop income-generating activities. Also contributes to the reduction of stigma and discrimination against people living with the HIV, reduce the poverty, and reduce self-stigma and discrimination, which led to increased self-esteem, which enabled people living with HIV to live a dignified life.
Stigmatization was an pressing issue for people living with HIV, and there was no associations yet to support us. Fortunately, in 2003, with RRP+ intervention, things have changed. They ensure that we got access to quality care and treatment, especially for pregnant women. Through our RRP+ advocacy, our children got access to free education, and associations were created to help parents to work in cooperative so that they can sustain their family needs.
With the support of different partners, including the government of Rwanda, through the Ministry of Health and other development partners, RRP+ is committed to contribute in reduction of new HIV infection in Rwanda.